CAFA is a Department of Health funded project, and Hampshire is one of 9 Phase 1 demonstrator sites that are testing and evaluating innovative approaches for information sharing. The aim of this pilot is to reduce the number of times an individual gives information, to improve the quality of referrals, and to ensure that key information is shared promptly and efficiently with all concerned. We are holding our first pilot in Petersfield. It will run for approximately 3 months, starting from February 2010. 4 health and social services teams are participating, and these are a community innovations team, a health service rapid response team, a community hospital social work team, and an adult services response team. There are 3 technical components making up this early pilot. A new form has been designed to capture common assessment information, and this will be tested by the multidisciplinary teams. Digital pens will be used to capture some information, as will direct entry into a web-based form. The information captured will be saved to and shared via an online server, and then stored in the Hampshire Health Record database. Hard copies of the form will be left with citizens to form part of their personal health record. A cornerstone of our work with CAF is to develop a common assessment form that can be used by health and social care personnel. This will be used in conjunction with the digital pen technology so we can capture data in the central repository. To develop this form, we looked at the information in partnership with health and social care professionals that was captured on a day-by-day basis. We also spent a lot of time with service users and their carers, exploring what information they felt was important to share, and in particular to access in an emergency. This first form has been designed to capture and accommodate all of these needs and requirements, and it's likely to be refined through use and as the pilot progresses.
Digital pen is a great example of how the technology actually provides an enabler, a tool to be able to carry on what you're doing normally, but actually allow for some clever technology in the background. With a digital pen, you're able to write on a form exactly as you would do with anything else, but when you actually get the digital pen back to base, back to a computer, we can actually get the information from the form, put it onto a screen. In this case it goes onto a server. You log in and see it over a secure connection. You can check that it's all correct, make any changes to spellings and so on, and then what you get at the end of it all is an electronic file, a PDF, and in the future we'll be able to send that directly into a database, so we can share that information almost instantly without any real additional work to what you would do normally.
I think the CAF pilot will enhance how we work. It will allow us to hopefully gain information from other teams and other services that have been involved in that patient's care, which at the moment we don't get that chance to find out unless the patient remembers who has been involved. Before CAF we didn't have any access to computer records. We did all our assessments on paper in the home, and then we took them back to the office to rewrite, so we had a set of base notes as well as patient's notes. The use of technology will be able to capture that information at that time and record it straight away onto the electronic records, which then will be able to, any team, if they have the consent of the patient, to able to access. So it is, rather than having information that could be out of date, it is of that time.
I've come out to complete your assessment with you today. Can I just get you to check your address and phone number for me, please? Part of the assessment that I want to fill in with you is who you would like us to contact in case of an emergency. Okay, so can you give me details of your next of kin?
Yes, Mrs. Smith.
Derek, can I just ask you to look at this section, please? Can you tell me what formal care or support services you're currently receiving?
Okay, let me have a look. Okay, so, occupational therapy and general practitioner.
Okay, brilliant, thank you. Well, there we are, Derek, there's your assessment.
Okay, and what are you going to do with this information? Don't you need to keep it?
Well, that information is actually stored on this digital pen. It'll go onto the Hampshire Health Record, which you've consented to, which enables all professionals involved in your care to access the information we've discussed today.
Okay, and I keep this, do I?
You do, yep. There's a pack there.
Okay, thank
I've
you.
also got some guidance notes on the assessment which we've filled in. There's also an information leaflet about the Hampshire Health Record.
Oh, great, thank you very much.
Well, thank you, Mr. Smith, and I'll see you soon.
Okay, thanks, bye.
Okay, so been out to see a patient. We've done the assessment. The paper copy has stayed with the patient, and everything's been stored on the pen so that we can upload it to the Hampshire Health Record. I'm going to do this one going like so. And then we have our record that we've already recorded within the house. So the information that has been captured on the digital pen has now been uploaded onto Hampshire Health Record, which allows teams that have access to the records by the patient's consent to see what we've actually recorded. This has really developed very quickly since the workshops. We're talking a matter of months. Mostly new projects could take years to plan and then realise that things don't work. I think it's nice. I think it's great that we've been involved so we can actually get the pilot process to actually work for us rather than being told what to do. The digital pens have been extremely easy to use, and with it uploading straight onto the Hampshire Health Record, it's already there. It's been extremely easy. I was expecting a lot of hiccups. There have been a couple, but they've been ironed out, and using the digital pens and Hampshire Health Record has been really, really good.
The Petersfield Pilot will allow us to refine the processes and information technology architecture to deliver reliable performance. Our next steps will be looking to increase the numbers of citizens we're working with and also to extend the professional networks beyond the Petersfield area, perhaps to acute hospital discharge pathways or other areas of community specialism. We will also be piloting person-held records and approach to citizen access to information. We are currently exploring how the approach that we have taken with CAFA may complement other health and social services initiatives regarding personalisation.